Thank you so much. Time for our Fox 4 House Call with Dr. Andy. And this morning we're talking about blood thinners and the dentist's office. And this is actually a question you received.
That's correct. I had a gentleman, he emailed me because he takes COUMADIN to thin his blood because of an irregular heartbeat. And he was on his way to the dentist's office to get an extraction and a root canal done. And in the past, he's been told that he should stop taking the medicine so he doesn't bleed too much in the dentist's office. And so he was asking if that was still the case. And it's interesting because if he'd asked me that same question a year ago, I would have said, yes, don't, stop your COUMADIN, talk to your doctor, but stop your COUMADIN most likely so you don't bleed too much. That's all changed in the last several months.
In just 12 months?
Well, the American Academy of Chest Physicians has come out with new recommendations, and it's now found that for patients who are undertaking minor dental procedures or minor surgical procedures with dentists or with, say, a dermatologist, who take certain blood thinners for other heart conditions like COUMADIN for irregular heart rhythms, that the risk of bleeding is actually less than the risk of developing a blood clot if you stop taking your medicine temporarily.
And that clot, obviously something far more serious to worry about.
Definitely. What we're talking about is a blood clot forming in your heart if you're taking one of these medicines and you stop. And that clot can then travel to your lung, causing a blockage in your lung, or to your brain, causing a blockage there, which is also known as a stroke.
And we certainly don't want that. So is there any point when maybe going to the dentist or doing a procedure would warrant stopping the COUMADIN or getting off the drug?
Absolutely. Every patient, of course, is different. So everyone has a slightly different risk for developing a clot or bleeding, which then warrants them to be on or not on COUMADIN. Some people might be okay with a medicine called Plavix. Some people might be okay with aspirin. For most people over 50, just taking an aspirin just to keep themselves healthy, it wouldn't hurt you to go ahead and stop your aspirin beforehand, talk to your dentist. But if you're taking COUMADIN in this particular case, if he's taking COUMADIN for an irregular heartbeat and you're getting a relatively minor surgical procedure done in the dentist's office, talk to your dentist, talk to your doctor, and check the guidelines, because excessive bleeding is actually not as dangerous in this particular man's case than it is to develop blood clots.
And that's something to definitely keep in mind. And just like this gentleman emailed a question, go ahead and email Dr. Andy. You never know, it might become a topic of our house call chats. info@drandy.us. 694-6246 is the phone number. Dr. Andy, thank you so much. We'll see you in 2 weeks.